Take off your socks right now and look at your feet. Because the five changes I'm about to show you, changes that millions of seniors notice every single day and dismiss as nothing, are your body's most reliable early warning system for heart disease, diabetes, kidney failure, and nerve damage. Your feet reveal everything. And after 65, they speak louder than any blood test. In the next 19 minutes, I will show you exactly what to look for and what to do the moment you find it. Before the five changes, you need to understand why the feet are such a powerful diagnostic window. Particularly after 65, your feet are the farthest point from your heart, the final destination of your circulation, the lowest point of your body where gravity concentrates fluid accumulation, and they contain the longest peripheral nerves in your body, running from your lower spine all the way to your toes, making them the first place where nerve damage becomes detectable. Four specific reasons make the feet the body's most reliable early warning system after 65. First, circulation is hardest here. Your cardiovascular system must work against gravity to deliver oxygenated blood to your feet and then overcome both gravity and distance to return that blood to your heart. Any weakness in heart function, any narrowing of arteries, any inefficiency in your venous system is amplified at the feet where the circulatory challenge is greatest. Problems that are invisible elsewhere in your body become visible in your feet first. Second, nerves are longest here. The peripheral nerves supplying sensation to your feet travel the longest distance of any nerves in your body. Long nerves are the most vulnerable to damage from elevated blood sugar, nutritional deficiencies, toxic exposures, and inflammatory conditions. Nerve damage, neuropathy, appears in the feet years before it appears anywhere else in the body. Third, fluid accumulates here first. When your heart, kidneys, or liver are not functioning efficiently, excess fluid accumulates in body tissues. Gravity concentrates this fluid in your lowest point, your feet and ankles. Systemic fluid imbalance that is invisible in your face or hands becomes visible as foot and ankle swelling. Fourth, skin is thinnest and most revealing here. The skin on the top of your feet and around your toes is among the thinnest on your body, making underlying color changes, circulatory changes, and tissue changes visible to the naked eye that would be hidden by thicker skin elsewhere. A study published in the Journal of the American Podiatric Medical Association found that systematic foot examination in adults over 65 identified previously undiagnosed serious medical conditions in over 30% of cases. 30% of seniors had conditions their feet were already showing that nobody had noticed. Now, the five changes. Change one, swelling that pits when pressed. Press your finger firmly into the skin just above your ankle bone right now. Press firmly for 5 full seconds, release slowly. Does the indentation remain, a small dent in your skin that takes several seconds to refill, or does the skin spring back immediately? If the indentation remains, you have pitting edema. And after 65, pitting edema in the feet and ankles is one of the most specific external signs of three serious internal conditions: heart failure, kidney disease, and liver disease. Here is what each condition does. In heart failure, your heart cannot pump blood forward with sufficient force. Blood backs up in the venous system, the veins returning blood to your heart. The increased venous pressure forces fluid out of blood vessels into surrounding tissue. Gravity concentrates this fluid in your lowest point, your feet and ankles, producing the pitting swelling I described. In kidney disease, failing kidneys cannot efficiently remove excess fluid from your body. That fluid accumulates in tissues throughout the body, with the feet and ankles showing it first and most dramatically due to gravitational concentration. In liver disease, your liver produces albumin, the protein that keeps fluid inside blood vessels by maintaining osmotic pressure. When liver function declines and albumin production falls, fluid leaks more readily from vessels into surrounding tissue, again appearing first in the gravity dependent feet and ankles. Three different organ systems, three different mechanisms, one visible sign, pitting edema, that flags all three. The morning timing of pitting edema is clinically significant. Swelling that is present or worse in the morning after hours of lying flat indicates more advanced fluid retention than swelling that only appears after a long day of standing. When you are horizontal overnight, fluid distributes more evenly throughout your body. The moment you stand in the morning, gravity immediately begins concentrating that distributed fluid in your feet. Morning pitting edema means there is so much excess fluid in your system that even overnight redistribution cannot clear it. A study from the European Heart Journal found that bilateral pitting ankle edema, swelling with pitting in both ankles simultaneously, was present in over 60% of seniors with heart failure at diagnosis. And in the majority of cases, it had been present and gradually worsening for weeks or months before any formal diagnosis was made. If you find pitting edema in your feet or ankles, particularly morning edema, and you have not recently had your heart function, kidney function, and liver function assessed, request these evaluations from your physician this week. Ask specifically for BNP, a blood marker of heart strain, EGFR for kidney function, and liver enzymes, including albumin. Emergency sign: if pitting ankle swelling appeared suddenly over hours rather than days and is accompanied by shortness of breath, call emergency services immediately. This combination can indicate acute heart failure requiring urgent treatment. Change 2: color changes, pale, blue, purple, or red feet. Look at the color of your feet right now, particularly your toes and the soles. What color are they? Normal feet should be a flesh tone consistent with your overall skin color, slightly pinker when warm and slightly paler when cold. Any significant deviation from this pattern in either direction is clinically meaningful. Pale or white feet, particularly feet that become noticeably paler when elevated above heart level, indicate reduced arterial circulation. A simple home assessment called Berger's test can reveal this. Lie on your back and raise both legs to a 45-degree angle, holding them up for 60 seconds. Healthy feet with good circulation maintain their color. Feet with impaired arterial flow turn distinctly pale or white as gravity can no longer assist the compromised arterial pressure in maintaining blood delivery against an elevated position. Then lower your legs over the side of the bed or chair and observe. Do your feet turn red or dusky red as blood rushes back? This reactive hyperemia, the exaggerated redness that follows pallor on elevation, is a classic sign of peripheral arterial disease. The skin is so starved of oxygen during elevation that when blood returns in the dependent position, it produces a visible flushed response. Blue or purple toes, particularly when they appear consistently and not just in response to cold knee, indicate cyanosis, insufficient oxygen delivery to the peripheral tissues. This can reflect heart failure reducing cardiac output, severe peripheral arterial disease limiting blood delivery, or significant lung disease reducing blood oxygenation. A specific pattern called blue toe syndrome deserves particular mention. The appearance of one or more toes that are suddenly blue, purple, or mottled, while the surrounding foot skin remains normal color, can indicate cholesterol embolism. Small cholesterol crystals breaking off from arterial plaques and lodging in the tiny vessels of the toes. This is a serious vascular emergency associated with significant cardiovascular disease burden. Bright red or hot feet, particularly when combined with pain and swelling in a single toe or joint, can indicate gout, a condition of uric acid crystal deposition in joints that is significantly more common after 65, and that is directly associated with cardiovascular and kidney disease risk. Any new or progressive foot color change in either direction from normal warrants physician evaluation. Color changes combined with pain, with temperature changes, or with any of the other signs I am describing multiply their significance. Change 3: numbness, tingling, or burning sensations. Do your feet feel numb when you walk, as if you are walking on cotton wool or on a surface that feels wrong? Do you experience burning or tingling sensations, particularly at night when you are trying to sleep? Does it sometimes feel as if your feet belong to someone else, present but not fully connected? These sensations and the absence of normal sensation are the hallmark symptoms of peripheral neuropathy, nerve damage in the feet and legs. And after 65, peripheral neuropathy is one of the most common and most consequential conditions affecting seniors, present in approximately 26% of adults over 65, according to population studies. The most important cause to evaluate immediately is diabetes. Diabetic peripheral neuropathy, nerve damage caused by chronically elevated blood sugar, affects the longest nerves first, the nerves supplying your feet. It produces a characteristic pattern called stocking glove neuropathy, numbness, tingling, and burning that starts in the toes and feet and gradually moves upward, as if you were slowly pulling on a stocking. Critically, Peripheral neuropathy is frequently the first sign of diabetes in seniors who do not yet know they have the condition. The nerve damage can begin accumulating years before blood sugar rises high enough to trigger a formal diabetes diagnosis, making foot symptoms an early diabetes warning that most seniors and physicians miss. But diabetes is not the only cause. Vitamin B12 deficiency, extremely common in adults over 65, particularly those taking metformin for blood sugar or proton pump inhibitors for acid reflux, directly damages the myelin sheath insulating peripheral nerve fibers. The resulting neuropathy is fully reversible with B12 supplementation when caught early, but can become permanent if the deficiency persists for years undetected. Thyroid dysfunction, both hypothyroidism and hyperthyroidism, can cause peripheral neuropathy, kidney disease through the accumulation of uremic toxins that damage nerve tissue. Certain medications, particularly some chemotherapy agents, some antibiotics, and some blood pressure medications, and alcohol related damage. A study published in the Journal of the Peripheral Nervous System found that in over 30% of seniors with peripheral neuropathy, the underlying cause was treatable or reversible when identified early, making prompt evaluation critically important. If you have persistent numbness, tingling, or burning in your feet, request these specific tests from your physician this week. Fasting blood glucose and HbA1c for diabetes, vitamin B12 level, TSH for thyroid function, EGFR for kidney function, and a formal neurological examination. The additional consequence of peripheral neuropathy that makes it so dangerous is this: when you cannot feel your feet properly, you cannot feel wounds, blisters, or pressure injuries developing on your feet. Injuries that would be immediately painful and promptly treated in someone with normal sensation go unnoticed in someone with neuropathy, progressing to infections that can become severe, limb threatening, and even life threatening before they are detected. Change 4: slow healing or non healing wounds. Look carefully at the soles of your feet, between your toes, around your heels, and at any pressure points right now. Are there any open sores, wounds, cracks, blisters, or areas of broken skin that have been present for more than 2 weeks without healing? Non healing foot wounds are one of the most serious warning signs in all of geriatric medicine, and one of the most common pathways to outcomes that most seniors consider unimaginable, including amputation. Two conditions make foot wounds non healing in seniors, and they frequently coexist in the same person. The first is peripheral arterial disease, narrowing of the arteries supplying blood to the feet. Wound healing requires adequate blood flow to deliver oxygen, nutrients, and immune cells to the healing tissue. When peripheral arterial disease reduces blood flow below the threshold needed for healing, wounds simply cannot close. They remain open, they expand, they become infected, and without restoration of blood flow, they progress to tissue death or gangrene. The second is diabetic neuropathy, which prevents wounds from being detected in the first place. Seniors with neuropathy develop wounds from pressure, friction, or minor injuries without feeling any pain. By the time the wound is noticed, often by a family member or during a foot exam, it may have been present for days or weeks, already potentially infected, already potentially penetrating deeper tissues. These two conditions, peripheral arterial disease and diabetic neuropathy, are called the two pillars of diabetic foot disease, and their consequences are staggering. Diabetes Care reports that foot ulcers precede 85% of all lower limb amputations in diabetic patients, 85%, and that 50% of all lower extremity amputations in the United States are diabetes related. But the positive finding, and this is critically important, is that early detection and treatment of foot wounds dramatically reduces amputation risk. Studies show that specialized diabetic foot care initiated at the first sign of a wound reduces major amputation rates by up to 85% compared to delayed treatment. If you have any wound on your foot that has not healed within 2 weeks, any wound at all, particularly if you have diabetes, peripheral arterial disease, or reduced foot sensation, see a physician or podiatrist within 48 hours, not next week, within 48 hours. Change 5: changes in nail appearance, thick, yellow, or crumbling. Look at your toenails now. Are they their normal color and thickness, or are they thickened, significantly harder, and more difficult to trim than they used to be? Yellowed, brittle, or crumbling at the edges, pulling away from the nail bed? Toenail changes in adults over 65 are extremely common, affecting up to 50% of adults over 70, according to dermatological studies. And while the most frequent cause, onychomycosis or nail fungal infection, is not directly life threatening, its implications after 65 are more serious than most people realize. For seniors with diabetes or peripheral arterial disease, thickened fungal nails create specific risks. They alter the pressure distribution across the toes, creating new pressure points that can develop into wounds in feet with reduced sensation. They create portals of entry for bacterial infection when nails crack or when skin breaks beneath the thickened nail. And their treatment, which requires antifungal medications, must be carefully managed in seniors with liver and kidney disease because standard antifungal drugs are processed by both organs. But certain nail changes go beyond fungal infection and carry specific systemic significance. Terry's nails, ear, where the nail appears predominantly white with only a narrow pink or red band at the tip, indicate low albumin from liver disease. This is the same albumin deficiency I described in the swelling section, and its appearance in the toenails means liver synthetic function is declining significantly. Nail clubbing, where the nail curves dramatically downward over the tip of the toe in a drumstick pattern, indicates chronic low oxygen states from heart failure, chronic lung disease, or liver disease. Spoon shaped nails, koilonychia, where the nail curves upward like a shallow spoon, indicate iron deficiency anemia. After 65, iron deficiency anemia can reflect gastrointestinal bleeding, including from colon cancer, that produces slow chronic blood loss undetected because it is not visible in the stool. Any nail change that has appeared recently or progressed rapidly, particularly Terry's nails, clubbing, or spoon nails, deserves specific physician attention in the context of systemic health assessment rather than simply podiatric care. Now, let me give you a complete daily foot examination routine that turns the knowledge from this video into a daily monitoring practice. Every morning, before putting on socks, spend 60 seconds on this complete check. Press test. Press firmly above each ankle bone for 5 seconds. Release. Pitting means call physician this week. Color check. Look at both feet in good natural light. Normal flesh tone. Any blue, purple, or dramatic pallor. Photograph it and call physician today. Sensation check. Run your finger along the sole of each foot and between each toe. Note any areas where sensation feels reduced, absent, or abnormal compared to your other foot or compared to your hand. Wound check. Examine between every toe, around your heels, and under any pressure points. Use a mirror if needed for the sole. Any open area present more than 2 weeks. Physician within 48 hours. Nail check. Look at every toenail. Note any color change, thickening, crumbling, or separation from the nail bed. This entire examination takes 60 seconds. It covers every warning sign I described, and it gives you the earliest possible detection of changes that, caught early, are almost always manageable, but left undetected can become catastrophic. If you have diabetes, this daily foot check is not optional. It is as non negotiable as taking your medication. 5 steps, starting right now. Action step 1. Right now, after this video, examine your feet completely. Both feet, full examination. Write down anything you find, any swelling, any color change, any sensation change, any wound, any nail change. Action step 2. If you find pitting edema, blue or pale color change, a wound present more than 2 weeks, or Terry's nails, call your physician today, not tomorrow, today. Action step 3. Starting tomorrow morning, make the 60-second foot. Check your first daily habit before socks every morning without exception. Action step 4. At your next physician appointment, request a comprehensive foot examination that includes circulation check with ankle brachial index, sensation check with monofilament test, and nail and skin assessment. If you have diabetes, this should be happening at every appointment. If it is not, ask for it specifically. Action step 5. Share this video with every senior in your life today. Ask them to check their feet after watching, because one of them is looking at a sign right now, dismissing it as nothing, that their physician needs to see immediately. Your feet have been carrying you through your entire life, every step, every mile, every morning you get out of bed and begin your day, and they have been trying to tell you something through swelling that pits when pressed, through colors that should not be there, through sensations that feel wrong or absent, through wounds that refuse to heal, through nails that no longer look the way they should. These are not minor inconveniences of aging. They are messages from your heart, your kidneys, your liver, your nerves, your arteries, delivered through the only part of your body that shows them all simultaneously. You now know the language your feet speak. You now know what each change means. And you now know that 60 seconds every morning before your socks go on gives you a daily window into information that most seniors never access until it is too late to act on it. Look at your feet tomorrow morning. Really look. Subscribe to this channel for more senior specific, genuinely life saving health information every week. Hit the like button if this made you look at your feet differently. Leave a comment. Did you find any of these 5 changes just now? Thank you for watching. Take care of your feet. They have been taking care of you.